Chris was a tremendous athlete, a tremendous person. He was out jogging in our neighborhood, and all of a sudden a police officer showed up at our parents' house, and at first they thought it might have been a heart attack, but later it was diagnosed that it was actually he had succumbed to an asthma attack.
If you can't catch your breath, it feels like 6 herds of elephants all stampeding on your chest.
I always still recall those times when he was younger, before his diagnosis and immediately after his diagnosis, when we really struggled.
When they told me that it was lung cancer, I had a lung removed, it spread through my body, the feeling was one of devastation. The only thing that was persistent that causes lung disease that I had been exposed to over and over again that caused me to get sick and have some respiratory distress was that I was exposed quite a bit to secondhand smoke.
The American Lung Association is great because the people who work at the Lung Association and all the volunteers truly care about the mission.
Chronic lung disease and tobacco use are two of the most devastating public health problems in America. As the nation's leading expert in lung health, the American Lung Association is fighting to save lives by improving lung health and preventing lung disease. Through programs, research, and advocacy, the American Lung Association is fighting the scourge of tobacco addiction and helping people breathe easier. Education in the areas of asthma and environmental health empower people to take control of their personal health with the confidence to manage their disease and live life to its fullest. State, federal, and local advocacy efforts support policies to reduce secondhand smoke, clean up air pollution, and increase the use of clean, renewable energies and fuels. Advocacy efforts have resulted in strong smoke-free air policies in much of the upper Midwest, and we continue to work on smoke-free air laws in all of our states. Tobacco control and prevention programs are discouraging youth and teens from ever trying that first cigarette.
We met about once a week for about 10 weeks. It was nice meeting with the group because they would tell you their stories about what they were doing to help quit, or like how long they have been quitting and the effects that they were having, and so it kind of pushed you to quit as well.
Asthma education helps children and parents to cope with this disease and reduce the stress and anxiety that so often accompanies its diagnosis. There are also resources available for teachers, coaches, and healthcare professionals who care for children with asthma on a daily basis.
Asthma camp is so important. I didn't have a moment's worry about the time he was there. I knew there were physicians, nurses, respiratory therapists, all kinds of people trained to manage any situation.
I really like doing the ropes course, and I really like being able to go swimming and play basketball and hanging out with all the campers.
Research is the cornerstone of the Lung Association's work as we fund the search for causes, treatments, and ultimately, cures for lung disease.
Being a spokesperson for the American Lung Association, helping to raise money, helping to raise the issues around lung disease has been a very rewarding part of surviving and not just sitting around hoping that things get better.
Use your voice to help the American Lung Association make a difference. Become a member of the Legislative Action Network or get involved in special events occurring in your area.
It's a great cause and a great day.
Our children have got to be able to breathe.
Walking is easy. Walk by yourself or put a team together and increase your impact.
We'll have close to 100 employees in today's walk. It's important for them because they can see that our company cares about their families and care about them individually, and we care about the community.
We have a lot of corporate supporters who have come out. They've always supported the Lung Association, and now they want to make a difference in the asthma walk.
Of course it feels good. Doesn't it look like it feels good?
Easy breathers! I was a afraid it would be hard to raise money, and it turned out to be just the opposite.
All we had to say is that we were going to walk to make her lungs healthier, and people just started writing the checks.
We raised over $400.
We raised over $800.
We've raised $1,200.
$1,800.
We raised $3,000 this year.
$5,000.
$56,000.
We're here in memory of my daughter, Vicky.
We're all walking in memory of our dear friend, Courtney Benson.
What better way to start the day on a Sunday?
It's a beautiful day to fight asthma.
Walks are planned all over the country. All you have to do is call or visit your local lung association or visit our website. So join us.
If you or someone you love has been touched by lung disease, the American Lung Association can help. Please call the Lung Helpline. This free service puts you in contact with medical professionals and provides access to lung health information, counseling, and tobacco cessation services. Whether you're looking for support after an unexpected diagnosis or information on cessation programs, registered nurses and respiratory therapists are ready to help. We will breathe easier when people no longer suffer from lung disease and children no longer fear an asthma attack caused by poor air quality. With your help, we are one step closer to defeating lung disease. Until then, we are
fighting for air. Fighting for air.
Fighting for air.
Fighting for air.
For more information about how you can make a difference, visit your local American Lung Association. Your support will help save lives by improving lung health and preventing lung disease.